point out few points that are very crucial, very important in your implementation station. Errors you don't want to make. Remember, the goal is first time pass. Let's do this, guys. So for your implementation station, I want to take it from talking from the start. You must make sure your hand hygiene is done. You remember all them palm to palm and all of that. Yes, you have to do that, okay? Except they tell you otherwise. The thing you must not miss is your ID check. Now, when you get into your station and you've got a live patient or you've got a mannequin, never forget to do your ID check. What does your ID check consist of? It consists of you confirming the patient's name, their date of birth, and their hospital number, if it is a hospital setting, or if it is a community setting where it's the patient's home. ID check consists of the patient's name, their date of birth, and their house address. Sometimes some people ask to confirm with an ID card and things. You might have one, you may not have one, but make sure to confirm your ID checks depending on your scenario. Another thing you must not forget is allergy checks. Allergy check. You must confirm with the patient what their allergy is, and you must check that it tallies with what you've got on your document. Now, when you ask for allergies, you must be sure it is the same thing as what you've got on your document that the patient tells you. Also, make sure to ask for the reaction and check that your document has got the same reaction. Now, ID check, allergy check, most likely if it's a hospital setting, the patient should have an ID band which they wear on their wrist. Hospital setting, the patient should have an ID band that's white. Allergy band is red. So in a hospital setting you do a three-way check. Now, what's this three-way check? You ask the patient says it, 1. You confirm with the document, it tallies, 2. Confirm with the wristband, 3. ID check and your allergies in hospital scenario or hospital setting must be a three-way check. Right. Because in the patient's house, if it was a community scenario and is a patient's house, remember the patient will not have an ID band or an allergy band. So that's why some people ask, can I have an ID to confirm with this? So please, in implementation station, we can't make the error of forgetting the first ID check. Then we go on to say you must make sure when you want to dispense the medication, before you start to turn out the medication from the containers, you must make sure that you read the medication and the expiry date on each bottle. Okay? Read the medication, the dose, and the expiry date on all of the bottle once you start to dispense. This is very important. These are things that if you don't do, is a red flag, and you don't want to do that, okay? Another thing I would like you to note here, once it comes to checking for the medication wherever they are kept, make sure you pick up the dose according to the prescription. What am I trying to say? Like if they've said maybe particular medication, amlodipine, the prescription is, let's say the prescription says 5 milligram. Okay? Some people just look around and they see 10 milligram. Some may then say, oh, the prescription comes in 10 milligram. I'll be dividing the medication into 2. That's not so good. please make sure to check very well. Most likely you should have the medication that comes in 5 milligram, because I don't think it's encourageable to break your medication in your exam. Some people that this has happened to, the medication has always been there, but they just didn't check. So please, if a medication, the prescription comes in 5 milligram or whatever it is, and what you see there is 10, do well to check very well. I'm sure you will see your medication, the one you need. Because I know we've seen scenarios where people come back and they said, oh, they were not supposed to break the medication, or they give the wrong dose just because they didn't check properly. So please check properly. You would see the right dosage of the bottle depending on the medication you are supposed to give. Another thing you must not miss is coming back after doing all your prescriptions. You cannot miss the 5 rights of medication, making sure it's the right drug, the right patient, the right dose, the right route, and the right time. You must confirm that. Also, you must never forget to confirm that the prescription is valid, legible, contains the prescriber's signature, and bleep number. These 2 points I've just mentioned, they are so key. If you check on your marking criteria, you see them there. And other points are like that I've just mentioned. Okay? Another thing you must not forget to do is your second ID check. Now, your second ID check is done once you've just gone into the patient, when you've prepared your medication all in the trays, then you bring it back to your patient. Before you go on, before you say anything, please confirm. All right, Miss Jones, I'm back to administer your medication. But before I go on, I'd like you to confirm your name again for me. Confirm your date of birth, any allergies, and then what is the reaction. 2 ID checks in medication station. Please don't forget that. Second ID check is very important. After you've done your second ID check, you want to talk about the medication you're giving to the patient. So you inform them, these are the medication I've got. However, the indication, you have to state all indications and side effects of the medications you're giving. Okay? So for every medication you're giving, let's assume you've got paracetamol and oxybutynin. So you say, I'm giving you your paracetamol. The indication is, of course, we know it's for your pain. The side effect is, then you say whatever it is, gastrointestinal disturbance, constipation, depending on what it is. You must mention the indication and side effect of any medication you'll be giving to the patient, and then confirm if the patient is okay to go ahead with the medication. The last point I would like to talk about, which is not the least, we can talk about more in another video. In the implementation station, never forget to check that your patient has swallowed their medication. Okay? Never forget to ask the patient, are you okay? Have you swallowed the medication? Or can you confirm with me that you have swallowed the medication? Right? I've just listed out few points, very vital, that you can't forget in your medication station. Right? I'll leave this here. Before you go on, please do well to put down your comments or any question, and like, subscribe, please, and don't forget to share. Hit that like button, okay? See you later.